Let's learn about tuberculosis prevention. Infection is transmission from reservoir to host to three modes of transmission. One is contact, airborne, and droplet. Tuberculosis is one of such infection which gets transmitted from airborne route from the reservoir to the host. So if you want to prevent tuberculosis, we want to put some precautions that will break this airborne mode of transmission in tuberculosis prevention and control. Let's understand the difference between airborne and droplet because often tuberculosis is understood as droplet infection. Tuberculosis is an airborne infection where particles are less than 5 microns. It spreads more than 3 feet distances, suspended for longer duration. N95 respirator is worn by the healthcare professional. Patient is instructed to wear a mask. Patient is isolated in the negative ventilation room. While droplet infection of more than 5 microns, spread is less than 3 feet, suspended for lesser duration, healthcare professional wears a mask. Example, diphtheria, pertussis, meningitis. Tuberculosis is an airborne infection, spreads by coughing, sneezing from the active patient of tuberculosis. Once the patient is started on treatment, the patient remains non-infective after 14 days of treatment. Now, in such cases, what to do? The risk of infection. Everyone. So when the TB most infectious, when it occurs in the lungs, that is it is when it is pulmonary tuberculosis, and until the patient is completely rested before at least 2 weeks of therapy. Factors affect the risk of transmission include patient, recipient, bacterial, and institutional. Factors include the infectiousness such as sputum, smear, cavitation, force, and frequency of cough. The cough-inducing procedures, treatment, understanding of TB, cough etiquette, and adherence to infection control practices. General health status like immune status, nutrition, co-morbidities, and diabetes. It is influenced by the number of infectious bacilli. The recipient factors include closeness, duration, and frequency of contact, risk of TB infection like prior treatment, age, homelessness, contact of known case, adherence to IC practices, and susceptibility such as either intrinsic or acquired, such as immune status, general health. Factorial factors include increasing virulence of the MDR TB bacilli. Patients with MDR TB may infect more people due to prolonged period of infectiousness. The incident factors include the exposure in small enclosed spaces, lack of ventilation, recirculation of the contaminated air, collection location procedures, processing procedures, smear culture, testing, disposal procedures, time-lag detection, resistant drugs. Now, what are the controls as per guidelines? These are managerial controls, administrative controls, environmental controls, and personal protective. Managerial controls include from the leadership management. Administrative controls include the reduction in the infrastructure such that there is a reduction of the opportunities for exposure. Environmental controls means there is a reduced concentration of infectious particles in the environment. Personal protective includes the wearing of N95. So, manager control to explain in detail, it means developing a facility plan, rethinking the use of available spaces, support trainings, ensure proper implementation, supervising of the administration screening. It is controls this patient screening, cough etiquettes, education for the patients, segregation of the respiratory symptomatics from the non respiratory symptomatics, then fast tracking of the respiratory symptomatics, jumping the queue, the elements of rough cough etiquettes are the source control measures, hand hygiene, spatial super separation, healthcare personnel who are advised to observe airborne precautions and who are and others. Cough etiquettes includes covering the mouth and nose with a tissue or with an elbow while when coughing or sneezing. Separate the patients with symptoms in a well-ventilated area. The separation should depend upon the local setting and the patient population. So to minimize the opportunities for the fast tracking is required to after screening to prevent the spread of the tuberculosis areas like in OPDs. Keep the HIV plus positive patients safer and away from the MDR, TB or known sputum smear positive patients. Have a safe sputum collection. Keep aerosol genetic processes away from other patients like sputum collection or natural ventilation should be there and should ensure effective ventilation at all times in all climatic conditions. Where mechanical ventilation, this should be tried when mechanical ventilation is not possible. Ventilation should be effective when air moves from the clean to contaminated or there is a good air. Direction air flow should be ensured the local healthcare worker near the clean air source. Locate a person who is infectious near the place where the air is exhausted. This is an example of the correct working location, healthcare worker. Should maximize the natural ventilation with openings on opposite walls. Openings should be unrestricted. 10% of floor space should be openable, window area on each wall. Upper levels of the building should be higher from the ground floor. Stack ventilation could be tried. Wind tower ventilation by whirly birds could maximize natural ventilations. Of advantages of natural ventilation is it can be implemented immediately at a lower cost and with a high air changes per hour. Disadvantage is that it is uncontrolled, unpredictable, not suitable in cold weather. How to assess if the natural ventilation is adequate? It's where air changes is not able to be measured, as is usually the case in rooms with natural ventilation. It should be ensured that the air changes is at least 6 air changes per hour. This could be done by seeing that openings of the rooms should constitute more than 20% of floor area. For example, 100 square feet is the room area should have more than 10 square feet as a two fixed unrestricted openings on both the sides, so the cross ventilation is there. Natural ventilation should be controlled with fixed unrestricted openings that are insensitive to climate. Now, what's wrong here? Very poor ventilation, blocked windows, recirculating air conditions, effective filtration. Such devices gives the false security. A crowded waiting area, waiting outside, exhaust fan will draw air from the waiting to the doctor's chamber. So that's again against the ventilation.